of speech is what she asked.
I'm sure that you know that smoking harms the body. So why do people do it? Maybe they do it because they haven't really become aware about all the effects that smoking has, or they are not ready to quit. There are a lot of reasons why a person shouldn't smoke. Smoking affects your health and appearance, and it also is an expensive habit to support. Cigarettes have about 3,000 toxic chemicals inside of them. Once a cigarette is lit, others around you are also affecting their lives. But people are too busy making themselves feel good to think about those who don't smoke and who may be offended by it. The first point I will argue is how bad smoking is for your health. Cigarettes contain 3 harmful substances: nicotine, tar, and carbon monoxide. Nicotine is a highly addictive drug that acts fast, only taking 10 seconds to reach the brain once inhaled. Nicotine also causes blood pressure to rise and may cause heart attacks. Cigarettes also contain tar. Tar is a brown sticky substance that blocks your lungs and decreases the amount of oxygen that can get into your bloodstream. Tar can also cause lung cancer, which is life-threatening. Carbon monoxide is also in cigarettes. Carbon monoxide is a poisonous gas that also prevents oxygen from circulating in the body. With time, smoking will cause smoker's cough, which is when smokers have to clear their tubes in their throat and lungs. Smoking also makes it very hard to exercise with the lack of oxygen that circulates the body. The person will find themselves gasping for air after a very short workout. Carcinogens are also found in cigarettes, which are cancer-causing agents that damage genes that maintain the growth of cells. Damage to the cells causes them to grow abnormally or to reproduce too quickly. There are many ways that cigarette smoke is found to be damaging to the body. According to quitsmoking.com, one is oxidative stress, which mutates DNA, promotes atherosclerosis, and leads to chronic lung injury. Oxidative stress is known to be in control of the aging process that also contributes to the development of cancer, cardiovascular disease, and COPD. Would you really want to inflict yourself with all these problems? Another reason to why smoking is bad is that it makes your hairs and clothes smell, ages your skin faster, and turns your teeth, tongue, fingers, and fingernails yellow. Smoking increases the risk for both premature graying and hair loss. Cigarettes will lead to dental issues due to the gum tissue being harmed from smoking. According to thegoldenrule.com, the long-term effects can include bad breath, tooth discoloration, swelling of the salivary glands, and the buildup of both plaque and tartar. Cigarettes can destroy what would otherwise be a beautiful smile. If you compare a person who's been smoking for 10 years with a non-smoker, the non-smoker may look younger than the smoker. Smoking is known to speed up the skin's natural aging process, which will cause premature wrinkles. Nicotine narrows the blood vessels and impairs the natural rate of blood flow to the skin. If blood flow isn't able to flow to the skin at a normal rate, the outer tissue loses necessary nutrients such as oxygen and vitamin E. These nutrients increase elasticity and prevent wrinkles from forming. Many years of smoking, smokers may develop wrinkles earlier than non-smokers. In addition to harming the teeth and the skin, smoking can affect the hair negatively. The end results may be either thinning of the hair or baldness. Most people understand the effects smoking can have on their internal organs, but it can also eventually destroy the outer appearance. Fortunately, these appearance changes usually occur over time. This means they can easily be reversed if the smoker decides to quit. Whether you're a new smoker or have been smoking your entire life, quitting can be tough, but with the right plan and a positive attitude, you can replace your smoking habits, manage your cravings, and quit the habit for good. Smoking is both a psychological habit and a physical addiction. In order to quit smoking successfully, you'll need to address both the habit and the addiction by changing your behavior and dealing with the withdrawal symptoms. People mainly smoke to manage stress, depression, loneliness, fear, and anxiety. There are many other ways to manage these feelings without the need to smoke. These may include exercising, meditating, finding relaxation strategies, and practicing simple breathing exercises. For most people, all it takes to quit is for them to find alternative ways in making themselves happier. Even when cigarettes are no longer a part of your life, the unpleasant feelings that may have prompted you to smoke in the past will still remain. So it's worth spending some time thinking about the different ways in dealing with stressful situations and the daily irritations that would normally have you reaching for a cigarette. WebMD.com gives suggestions on how to stop smoking that include cold turkey, which means quitting alone without help. About 90% of people quit this without aids, therapy, or medicine. However, this way is not the most effective and successful method. Only about 10% of people who try to quit this way succeed on their first try. Behavior therapy is another method. With behavior therapy, you visit a therapist who will help you find the most effective way to quit. The therapist will help you to identify your triggers, come up with ways to get through cravings, and provide emotional support when you need it most. Another method is nicotine replacement therapy. This method includes nicotine gum, patches, inhalers, and sprays. Replacement therapy works by giving you nicotine without using tobacco. A person is more likely to quit when this method is used. This therapy works best when combined with behavioral therapy and lots of support from friends and family. Some drugs include Zyban and Chantix, are formulated to help people quit smoking, but a doctor will prescribe the best one. Combination treatment is the last method. Using a combination of treatment methods can increase your chances of quitting. For example, using both a nicotine patch and gum may be better than a patch alone. Other proven combination treatments include behavior therapy and nicotine therapy, prescription medication with a nicotine patch and nicotine spray. In conclusion, a person should never try just one cigarette because my speech provides evidence on how addicting and harmful smoking is. Smoking is very expensive and takes time off lives. One pack of cigarette takes about 200 minutes off your life. One pack a day for 1 week is 1,400 minutes off your life and $35. In 1 year, 72,000 minutes will be subtracted from your life and will have costed you roughly $1,800. Every year, hundreds of thousands of people around the world die from diseases caused by smoking cigarettes. Personally, I would not like to have bad breath, yellow teeth, or fingertips, or smell like smoke. If you do smoke, I have included many helpful methods to stop smoking that have worked for others. You just have to be ready to give up the habit.